Amber is a 16-year-old soccer athlete, and she's now 7 weeks after an ACL tear. And we did a semitendinosus reconstruction on her, Tim, and the procedure went well, and she's got a nice stable knee at this point. Just let it go real loose, and she's got good stability, and she's got good motion. And you've done a very good job of getting that motion all the way up by 7 weeks. And she still lacks maybe a couple degrees.
A couple degrees, yeah, she does. And she can tell.
Extension. And she can tell that that knee is not straight. So I know you have her on the overpressure program. But the interesting thing is that we had tears of both the medial meniscus and the lateral meniscus, and they were the ideal type of red tear where we could use an all-inside technique. So we used an all-inside suture-based technique to repair the medial meniscus and as well the lateral meniscus. And of course that, I think that was beneficial to her, but it certainly indicated she had a lot of trauma when she damaged this. She tore ACL and essentially tore both of her meniscus. And her desire is to get back to soccer.
Right.
And Amber, would it be all right to say that maybe you haven't been doing your exercises quite up to quite up to snuff?
Yeah.
And so we've had a little discussion on this at 7 weeks. And what do you think of the muscle atrophy that she has, Tim?
Well, it's very easy to kind of see, that she has started to develop a little bit of what we kind of used to refer to that Coke bottle appearance to the leg, where the muscle is shut down, she's a little bit wider, and then kind of tapers back out. So while I think that she still has some mild swelling, sometimes the appearance of the joint looks a little bit larger because she's lost that muscle control through her VMO. So exercises right now we would be looking for, we reinforced her isometric wall sit, making sure that she's pushing to the muscle burn.
No, the wall sits are very important. You're going to do that 8 times a day.
8?
8.
Okay.
8 times a day. You're going to really get that burn. So the rule is that she holds it till she can't hold it any longer, then she counts to 30.
Okay.
And again, that's like a stationary leg press.
Exactly.
Yeah.
So again, that we can be safe in terms of pressure on the meniscus, because we can go ahead and protect her angle at how far down she goes, but making sure that we get deep enough that we get a good activation out of her quadriceps. I think at this point it's safe to go ahead and begin some open chain exercises, but in that lower 90 to 40, 90 to 30 range, so that we are protecting the graft at this point in order to get the activation out of her quadriceps. She's at a point where she's still been struggling because of the muscle weakness to come off of the one crutch, so gait retraining would be another activity to initiate, and making sure then that we're getting adequate activation out of her quads in mid-stance so that she doesn't drop into that hyperextension or quadricep quiet gait.
Yeah, that's
with
a really
her muscle being starting to thin out.
That's really important point. Just to amplify on that, we're going to expect it if she was to walk off and not use crutches, she'd have a hyperextension gait.
Right.
She wouldn't be using her quadriceps because she doesn't have full muscle support. So,
or she would be, because she doesn't have quite extension, she might on the other end go into 12, 15 degrees of flexion and begin to walk with a flex knee pattern as well. So again, the gait then becomes important for us to work functionally to get quadricep control, so that we could look at doing a little bit of retro walking within the confines of the treadmill. We'll be doing some cup activities to look at making sure that she's getting an adequate push-off, an adequate activation out of her calf, mid-stance quadricep control for quads, and then looking at hip control as well to make sure that she doesn't circumduct or hike her hip as she's now moving through swing.
So she can start to do her toe raises and start to do her hip strengthening exercises. And this is to really work that quad. This is, when do you think you're going to have a really good quad here? Don't you think it's going to be by 6 months post-op, unfortunately?
Unfortunately, I think that we're looking at that. I mean, we would be looking to, in essence, protect return to activity because of her bilateral meniscus repair, because she's a soft tissue graft. But with this early muscle thinning now, again, it will probably take her a good 3 to 4 months to regain strength, although at that point we still might see that she still has a little bit of girth deficit at that point.
Good. Okay, well, you've done very well. But so our goals then are to get the rest of the motion and then we can start to really work this quad. And if we get that quad working, then you'll be off your crutches very soon. I'm sure you're anxious to do that. And then we'll probably come along at about the 3rd month and really start to do more efficient quadricep strengthening.
Right.
Like you said, open chain work, but not to the point where we'll do any lunges or anything else. That's far down the road at this point, isn't it?
Right.
Because I have to protect those meniscus repairs. Good.